Are there chances for natural conception in patients with low AMH? When do I go for IUI or IVF? Are the common questions I usually get in the practice. Dr. Kusuma here from Motherhood HRBR Unit, Bangalore. Yes, definitely there are chances of conceiving naturally even in the cases of low AMH. But again, it depends upon the age factor. In patients who are less than 35 years of age, the chances of conception with low AMH, natural conception, is quite high, and it is similar to those patients with the normal AMH values. But when the age drops between 35 to 40 years, then the chances slightly reduces, and this is because of the less ovarian reserve as well as the less the poor quality of the eggs. And once they reach 40 and above 40, the chances of conception significantly comes down. In general, the per cycle success in the case of low AMH depends upon the age. If they are less than 35 years of age, the chances are between 10 to 15%, and if they are between 35 to 40 years, the chances of conception are between 8 to 10%, and above 40 years, it is just around 3 to 5%. But one thing we have to remember is that the monthly chances of conceptions are slightly reduced because of the less ovarian reserve. Now, what are those conditions when we recommend IUI? If a person has tried ovulation induction or naturally for quite a long period of time with no success, then we can slightly increase the chances of success by doing IUI. Maybe other infertility factors or sperm factors may be present for which IUI might be helpful, and reasonably we get a good success rate in these conditions as well. But remember that the attempts have to be limited. Say hardly some 3 to 4 attempts are quite okay till we reassess the treatment. Now, when do we recommend for IVF, which the patients usually do not want to undergo? This is a very important factor in low AMH. If the patient's age is advanced reproductive age is a very important factor. That is because the quality of the eggs comes down. Very low ovarian reserve is the second one, where the AMH drops down to less than 0.5 nanogram per ml. If we have to subject the patient to any of the genetic tests, then this IVF is very essential because we do it on the blastocysts. Thirdly, if a patient has undergone multiple treatments, multiple cycles of ovulation induction, failure of IUI cycles, for such patients we ask them to go for the IVF because significantly the chances of conception in IVF is as high as 30%. What are the IVF outcomes in these patients? If they are less than 35 years, it is as high as 30%, and more than 35 to 38 years, significantly the chances of conception or IVF success will come down. Age, ovarian reserve, and the prior response, all these three will help us in making decisions as to if the patient has to try naturally IUI or they have to go for the IVF. And this is because time is very crucial in these cases. We do not know how drastically AMH falls down. The trajectory is not determined. Initially, the AMH level comes down slowly, but after some time, drastically it starts falling down. In order to save the time and planning are very critical, and in order to help the patient to conceive at the right time, IVF is recommended. In order to know about certain myths and the carry home message, please check on to my next video.